Intro. Hello. Good morning, all of the students. May Almighty keep all of us safe in this pandemic. Let us start our class. Clinical topics is thyroid gland, its anatomy, physiology, and clinical features. You already know the thyroid gland is an endocrine gland. There are other endocrine glands. Now you should know about what is endocrine glands. Endocrine gland is the gland which secretes its hormones into the blood or internal body fluid. Other endocrine glands are hypothalamus, pituitary gland, adrenal cortex and medulla, islets of Langerhans of pancreas, uterus, testes, kidney, and others. But among them, thyroid gland is the largest endocrine gland of the body. No duct. It is the only endocrine gland which located superficial. It is the only endocrine gland which located superficially in the body. So we can do physical examination of this gland. Another special features is it is no duct. Can you hear me? Thyroid gland. Thyroid gland develops from thyroid gland have two cell, follicular cell and parafollicular cell. Follicular cell derived from thyroid diverticulum, median thyroid diverticulum in the primitive pharynx, and parafollicular cell derived from ultimobranchial body, that is fifth pouch. Follicular cell. Follicular cell এখানে আমাদের জেনে রাখতে হবে কি which hormone secreted by follicular cell and parafollicular cell. Follicular cell secretes T3 and T4. T3 that means triiodothyronine. T3 triiodothyronine. Or T4 tetraiodothyronine. T3 triiodothyronine and tetraiodothyronine. Parafollicular cell secretes thyrocalcitonin. Thyrocalcitonin. Now, shape of the gland and vertebral level. Vertebral level, cervical 5, 6, 7, and first thoracic vertebral level. Thyroid gland is H-shaped. Thyroid gland is H-shaped. There are two lobes, right and left lobes. You can see in the picture, right and left lobes, H-shaped, which is connected by the isthmus of thyroid gland. Isthmus of thyroid gland. Each lobe is connected. Right and left lobe is connected by isthmus of thyroid gland. Vertebral level of the thyroid gland, cervical 5, 6, 7, and first thoracic. Isthmus level along the midline, second, third, and partly fourth tracheal ring, not vertebral level. Second, third, and partly fourth tracheal ring. Sometimes another small pyramidal lobe projects upwards from the isthmus of thyroid. Sometimes a small pyramidal lobe projects upwards from the isthmus, usually from the left. Each lobe of thyroid has an apex, base, to lateral surface, superficial and posterior lateral surface, and median surface. Apex, each lobe of thyroid is roughly pyramidal in shape, and has apex, base, superficial or anterolateral surface, posterolateral surface, and medial surface. Superficial surface is related to three-step muscle: sternothyroid, sternohyoid, and superior belly of omohyoid. Superficial surface is covered by three-step muscle, that is sternothyroid, sternohyoid, and superficial belly of omohyoid. And apex extends up to oblique line of thyroid cartilage. Base extends up to 5 or 6 cervical vertebral level, 5, 6 cervical vertebral level. Anterior border, anterior border, and posterior border. Anterior border separates superficial from the medial surface. Anterior border separates superficial surface from the medial surface. Posterior border thick, anterior border thin. Posterior border separates medial surface from the posterolateral surface. There are two capsules, false capsule and true capsules. Now, what is true capsule? True capsule is peripheral condensation of the connective tissue of the gland. Peripheral condensation of the connective tissue of the gland. False capsule derived from pretracheal layer of deep cervical fascia. Pretracheal layer of deep cervical fascia. Okay? True capsule and false capsule. False capsule derived from pretracheal layer of deep cervical fascia, which is thickened at the medial surface, which is thickened at the medial surface and forms a suspensory ligament, which is called Berry's ligament or ligament of Berry. False capsule is thickened at the medial surface and forms a suspensory ligament, which is called ligament of Berry. Here we should know about attachment of the gland with thyroid and laryngeal cartilage and thyroid bone. Thyroid gland is connected to the laryngeal cartilage and hyoid bone with the capsule, which is attached to the laryngeal cartilage and hyoid bone. During swallowing, laryngeal cartilage and hyoid bone moves ups and down. So thyroid gland is also moves ups and down during swallowing because of the attachment of the capsule. Because of the attachment of the capsule. Thyroid gland weight 25 grams. It is larger in female than in male. It is larger than in female than male, and sometimes further increases in size during menstruation and pregnancy. Thyroid gland increases. uh, Thyroid gland is larger in females than in male and further increases in size during menstruation and pregnancy. Here we miss the position of the thyroid gland. Normal position of the thyroid gland is at the lower part of the neck, in front, lower part of in front and sides of the neck. Thyroid gland lies at the lower part of front and sides of the neck. But thyroid gland may located in other site, that is called ectopic thyroid. Ectopic thyroid. Normal position of the thyroid gland is lower part of the neck, lower part of the front and sides of the neck. Front and sides of the neck. Front isthmus and sides two lobes of thyroid. But it may present another site. That is called ectopic thyroid. Define ectopic thyroid. What is ectopic thyroid? What is ectopic thyroid? Ectopic thyroid. When thyroid gland lies rather than its normal site is called ectopic thyroid. When thyroid gland lies rather than its normal site is called ectopic thyroid. You should know about the sites of ectopic thyroid. That is lingual thyroid, cervical ectopic thyroid, that is thyroglossal, lingual thyroid, cervical, ectopic thyroid, that is thyroglossal, and intrathoracic thyroid gland. Usually found thyroid gland, ectopic thyroid gland at the lingual thyroid, cervical, ectopic thyroid, that is thyroglossal, and intrathoracic ectopic thyroid. Intrathoracic, that is very important. What are the other sides of thyroid gland? Most common, lingual thyroid. Ectopic thyroid, when thyroid gland lies rather than its normal site, is called ectopic thyroid. Again, ectopic sites of ectopic thyroid, lingual thyroid, cervical, ectopic thyroid, that is thyroglossal, and intrathoracic ectopic thyroid. Now the blood supply of thyroid gland. Blood supply receives from superior thyroid artery, branch of external carotid artery. Superior thyroid artery, branch of external carotid artery. Inferior thyroid artery, branch of thyrocervical trunk, which is a branch of subclavian artery. Inferior thyroid artery, branch of thyrocervical trunk, which is a branch of subclavian artery. Arteria thyroidea, ima branch of brachiocephalic trunk. Anatomically, inferior thyroid artery is important because it is closely related to recurrent laryngeal nerve, which is most vulnerable during thyroidectomy operation, and it is the guideline of recurrent laryngeal nerve. Superior thyroid artery, branch of external carotid artery. Inferior thyroid artery, branch of thyrocervical trunk, which is a branch of subclavian artery. Arteria thyroidea ima branch of brachiocephalic trunk. Venous drainage, superior, middle, and inferior thyroid vein. Superior, middle, and inferior. Lymphatic drainage into upper, middle, and deep cervical node. Into upper, middle, and deep cervical node. Nerve supply, middle cervical ganglion mainly, middle cervical ganglion, superior and inferior cervical ganglion, partly vasoconstrictor, recurrent laryngeal nerve, and external laryngeal nerve. Middle cervical ganglion, superior and inferior cervical ganglion, recurrent laryngeal nerve, and external laryngeal nerve. Here you should know about recurrent laryngeal nerve mainly. Recurrent laryngeal nerve, which is a branch of vagus nerve. Recurrent laryngeal nerve, branch of vagus nerve. And the supply of nerve supplying areas are It recurrent laryngeal nerve supplies all the intrinsic muscles of the neck, all the intrinsic muscle except cricothyroid, except cricothyroid. It is very important for Viva question. Recurrent laryngeal nerve, branch of vagus nerve, branch of vagus nerve. It supplies all the intrinsic muscles except cricothyroid. এখানে একটা প্রশ্ন করতে হবে, what are the intrinsic muscles supplied by recurrent laryngeal nerve? You should write posterior cricoarytenoid, posterior cricoarytenoid, lateral cricoarytenoid, thyroarytenoid, aryepiglottic, thyroepiglottic muscles. Posterior cricoarytenoid, lateral cricoarytenoid, thyroarytenoid, aryepiglottic, thyroepiglottic. That's intrinsic muscles are supplied by recurrent laryngeal nerve, and cricothyroid is supplied by external laryngeal nerve. That is very important question for Viva. Again, we repeat this. Recurrent laryngeal nerve, branch of vagus nerve, branch of vagus nerve. It supplies all the intrinsic muscles, lateral cricoarytenoid, posterior cricoarytenoid, thyroarytenoid, aryepiglottic, and thyroepiglottic muscles. And cricothyroid is supplied by external laryngeal nerve. There are right and left recurrent laryngeal nerve. Right and left recurrent laryngeal nerve. Right laryngeal recurrent laryngeal nerve lobes the subclavian artery. Subclavian artery. Longer course is longer, left recurrent laryngeal nerve. We further discuss about operative phase, about recurrent laryngeal nerve. Hormones. Hormones already we said, trifollicular cell and parafollicular cell. Follicular cell derived from thyroid diverticulum of in the primitive pharynx. Thyroid diverticulum, endodermal thyroid diverticulum. Follicular cell derived from endodermal thyroid diverticulum in the primitive pharynx. T3 triiodothyronine and T4 tetraiodothyronine. That is called thyroxine. Tetraiodothyronine. That is called thyroxine. These two hormones is important. It regulates the basal metabolic rate. It regulates the basal metabolic rate. and somatic and psychic growth of the individual. T3 and T4. T3 triiodothyronine, triiodothyronine, and T4 tetraiodothyronine. That is called thyroxine. They regulates the basal metabolic rate. They regulates the basal metabolic rate, and somatic and psychic growth of the individual. They regulate the basal metabolic rate and somatic and psychic growth of the individual. Parafollicular cell derived from ultimobranchial tract, that is fifth pulse, ultimobranchial tract, and release thyrocalcitonin. Thyrocalcitonin. Parafollicular cell release thyrocalcitonin. Yeah, you should know about thyroid hormones. Thyroid hormone synthesis depends upon external environment. That is the difference between another endocrine glands. Thyroid hormone thyroid hormone synthesis depends external environment for raw materials. Thyroid hormone synthesis depends external environment for raw materials, and that is the difference. Thyroid hormone gland is from another endocrine glands. These raw materials are iodine and tyrosine. Iodine and tyrosine. Tyrosine. And there are two types of cell: follicular cell and parafollicular cell. Thyroid hormone, triiodothyronine, thyroxine, thyrocalcitonin. These hormones synthesis depends upon external environment for raw materials, that is iodine and tyrosine. Here you should know what is the source of iodine. What are the sources of iodine? Source of iodines are iodized table salt, আমরা যে লবণটা খাই, খাওয়ার লবণ, iodized table salt, sea fish, vegetable near the sealant, and water. Again, source of iodines are iodized table salt, sea fish, vegetable near the sealant, and water. Yeah, you should also know about thyroid gland. Another abnormality or a feature is rather than other endocrine glands. Other endocrine gland directly secretes its hormones into the internal body fluid or blood, that is blood. But thyroid hormone, thyroid hormone directly, not act and directly, not directly pour its hormones into the blood. It stores and releases it as and when required. যখন সময় হয়, প্রয়োজন হয়, তখন রিলিজ করে। It can store its hormones. That it is the difference from another endocrine glands. Thyroid gland can store its hormones and release it as and when required. That is, according to requirements, it releases its hormone into the blood. Other endocrine gland directly pour its hormones into the blood, but thyroid gland can store its hormone and release it as and when required. That is very important. Now, examination of the thyroid gland. Examination of thyroid gland, not surgery. Examination of thyroid gland. What type of examination done? I already said you that is the only endocrine gland which lies superficially in the body. That is the only endocrine gland which lies superficially in the body. And other endocrine glands is the internal organ of the body, internal organ, not external. So we can examine this gland externally, and superficial examination can be done. That is palpation, auscultation, and other examination can be done due to its location. It located at the superficial surface of the body. Thyroid gland examination, at first inspection. We should look at the naked eye, any swelling in front or side of the body, front of the neck, in front or side of the neck, any swelling at in front or sides of the neck. If any tumor or neoplasm present one lobe, that is side of the neck. If a swelling at the midline, it may be at the lower part, it may be on the isthmus. Palpation, if any swelling present, then we can do palpate this swelling. What can we see or see during palpation? That is size of the swelling, temperature, consistency, fixity with overlying or underlying structure. Usually, thyroid gland is firm in consistency. Firm in consistency. Fixity with underlying and overlying and underlying structure. Deglutition test. Deglutition test. If patient swallow, if it is thyroid swelling, it moves ups and down. It moves ups and down during swallowing. But why? I already said this. Thyroid gland is connected to the laryngeal cartilage and hyoid bone with its capsule. Thyroid gland is connected to the laryngeal cartilage and hyoid bone with its capsule. Laryngeal cartilage and hyoid bone moves ups and down during swallowing. So thyroid gland also moves ups and down during swallowing because of its attachment of capsule with the laryngeal and cartilage and hyoid bone. Regional lymph node, হ্যান্ডের মধ্যে ট্রেমর, টেম্পারেচার, আই সাইন exophthalmos, lead lag, lead retraction. Exophthalmos, lead lag, lead retraction. Then auscultation. Now disease of thyroid gland. Disease of thyroid gland. Hypothyroidism, hyperthyroidism, goiter. Hypothyroidism, hyperthyroidism, goiter. What is goiter? Any enlargement of thyroid gland is called goiter. Any enlargement of thyroid gland is called goiter. Simple goiter, toxic goiter, neoplastic goiter, inflammatory goiter. Any enlargement of thyroid gland is called goiter, simple goiter, toxic goiter, neoplastic goiter, and inflammatory goiter. Now we discuss about hypothyroidism. Hypothyroidism. What are the symptoms of hypothyroidism? What are the symptoms of hypothyroidism? That is lethargy, weight gain, loss of appetite, cold intolerance, change of voice, rough, husky voice, menstrual disease, amenorrhea, constipation, lethargy, weight gain, loss of appetite, cold intolerance, change of voice, rough, husky voice, menstrual disease, that is amenorrhea, constipation. Sign. Patient is calm and quiet, dry skin, lustreless, elevation, bradycardia, ankle jerk delayed. The sign আমরা কি পাবো? Patient is calm and quiet, dry skin, lustreless, bradycardia, ankle jerk delayed. How can we diagnose of hypothyroidism of an individual? By very simple investigation, that is serum T3, T4 and TSH. T3, T4 and TSH. T3 that means triiodothyronine, T4 tetraiodothyronine, that is thyroxine, and thyroid stimulating hormone. Be careful. T3 and T4 is thyroid hormone, but TSH is not thyroid hormone. That is secreted by anterior pituitary gland. Anterior pituitary gland. Thyroid stimulating hormone is not an thyroid hormone, not a thyroid hormone. It is secreted by anterior pituitary gland. You should know. That is very important for Viva question. In case of hypothyroidism, functional status, that is T3 and T4 decrease, TSH usually increase, T3, T4 decrease, and TSH increase. TSH increase. Now the treatment of hypothyroidism. Treatment of hypothyroidism. Tablet thyroxine. Tablet thyroxine 50 microgram, not gram, 50 microgram. Tablet thyroxine 50 microgram. Please correct this. 50 microgram. Half an hour before breakfast. Tablet thyroxine 50 microgram. Half an hour before breakfast. Usual starting dose 110. Dose increases gradually starting from low. Usually started low dose. It may be 2 or 3 tabs daily according to requirements, but start from low dose, that is 50 microgram, half an hour before breakfast. Tablet thyroxine, this is the active form of thyroid gland secretion. That is thyroxine is hormone therapy. If hypothyroidism, we can advise tablet thyroxine 50 microgram, half an hour before breakfast. Dose usually start from low dose, that is a 1 tab, then gradually increases according to requirements and for further follow-up and requirements. That's all for today. Stay safe. Good evening.